Hello and welcome to StratNews Global. I'm Surya Gangadharan. The coronavirus is having an amazing impact in the United States. And to talk about some of those issues over there, we have with us Akshobh Giridhardas. He's a former journalist, currently Director of Client Services at a public policy company called the Bauer Group Asia. He's based in Washington, D.C. Akshobh, thank you and welcome.
Thank you, Surya, for having me. It's a pleasure to talk to you.
My first question. India has cleared the export of hydroxychloroquine to the US. So, how is it being seen over there?
Well, so far, President Trump himself came out with a tweet saying that he's very grateful. He called Narendra Modi his good friend, and the bonhomies almost just continued from the February meeting. I think right now it's as you rightly said before, it depends to be seen what this drug will do. There's no concrete proof that it is going to be a vaccine, but of course, India is the largest manufacturer of this drug. India is one of the largest pharmaceutical manufacturers. So at this point, in a call with the Indian ambassador to the United States today, the Indian ambassador relayed that the United States and India share a particular strategic partnership. So if the US required it, India will definitely put forward. So India is been seen as someone who's come to the aid. Now depends if that aid will help.
Rather strange, you're using the word aid. Normally it was in the reverse direction, the US giving aid to India. Now it's somehow the coronavirus has done a lot of changes here, no?
Yeah, absolutely.
Strange.
No, if you just think about it, Surya, we live in a very strange time because I can't remember a single time where the world has had the same economic, national security, and health crisis at the same time. From countries as tiny as Burkina Faso to as large as the United States, every country is facing the same issue. And this virus is something that can't be kept out by walls, cannot be kept out by any immigration controls. It doesn't need visas and passports to come in. It can't be countered with monetary policies, and it just cannot be ousted with elections or protests. So we've come to a point where, a few years ago, we're talking about ICBMs and nuclear threats, but this is something tinier than all missiles that we can't see and has had a bigger threat. So just think about the profound implication that we are in right now. We would have thought pandemics are a thing of the past, the 1918 Spanish flu, when the world was less evolved and we've got technology, but the entire United States, the largest economy, the most powerful country in the history of human modern day geopolitical imagination, has come to a standstill. And we're not out of the hole yet. We're probably even worse. Bill Gates estimates that by April end, we'll probably start peaking, which means we're just going up and up the graph. We've not even, it shows no signs of abating. New York is still showing cases. However, today they reported that there have been less hospital admits, but that doesn't mean that we're out of the hole yet. It's still lockdown for all of us.
Tell me about this lockdown. How effective is it? Is it nationwide? And is it basically driven by state governments or by the center?
Yeah, of course. As you know, U.S. is a federal system, but of course, individual state governors of various states have autonomy over it. Right now, the epicenter of the virus is New York State, so that's why Andrew Cuomo, the governor of New York, is constantly in the news and updating, the media on the ventilators, on the cases. The initial hotspot in the United States was Washington State, where patient zero of the U.S. was someone who had visited Wuhan, China, the epicenter of the virus, and Seattle was sort of where the first case was. So initially, when people looked at it as a China province, or oh, it'll be West Coast, which is not necessarily true because New York is a global city and DC is a global city, and this virus can come from anywhere. Who would have thought Italy would be one of the countries to implode first as well? And in fact, ironically, all the cases in New York, as the New York Times reports today, has come from Italy, not from China. So right now, it's state by state lockdown. The neighboring state to me, Virginia, is on a stay-at-home mandatory till June 10th. The DC mayor has also had a work-from-home policy for the whole month of April. Other states as well have various lockdowns. Of course, there are some states like Arkansas and Missouri that haven't initiated statewide lockdowns. Florida came under criticism because in March there is spring break where people love to go hit the beaches because they're coming out of winter, and
Yeah.
people, clouded to Florida beaches. It was looking like a scene of Jaws, like all these people on the beach, but something's going to go wrong. And now Florida is reporting cases. So Florida governor did not shut down. People were being there was a sense of myopia that was perceived by not shutting down because, it was like, I'm not going to affect my economy, but your
Yeah.
economy is going to be affected if you do not shut down. And right now, social distancing is not more than a pragmatic factor. It's become a necessary thing to do. Like India was sort of ahead of the ball curve from what I've seen and what the Indian ambassador said today in a call, because the cases are far more restricted. But the United States right now is on very, very red alert.
Tell me at a very common level, how do people see this? The manner in which China has handled it with a relative efficiency and the chaos in the US, and the image this is projecting all over the world.
Yeah, absolutely. Look, I mean, firstly, it's got to a point where people are clutching at straws. There's a sense of everyone. You've never had a scenario before where everyone is aware of what's happening at different levels. Like when if you think about other geopolitical events, you have oil price hikes. 90% of people don't care about it. Maybe 95%. If you have Fed interest rates, 95% of people don't care about it. But US and Iran, what happened earlier in Jan Feb, someone in Illinois is just worried about paying their mortgage. They don't care. But right now, this is affecting everyone. So whether you're in Wyoming or Montana or New York City or Los Angeles, you are affected by this. Everyone at every level, from the grocery store clerk to the CEO of a top Fortune 500 company, everyone is thinking about this as well. I mean, the CDC is obviously putting out daily updates, but the CDC is also strained. This if you've seen right now, Bernie Sanders has dropped out of the race, but one of the things that made Bernie Sanders very famous during his runs in 2016 and 2020 was talking about a political revolution and reforming American healthcare. As you know, America does not have state mandated, nationwide mandated healthcare like the way Canada does or some of the Scandinavian country does, and it's been very controversial. In various levels. I mean, President Obama's signature plan was called the Affordable Care Act, called Obamacare. That itself, healthcare is a very contentious issue, and you see on the Democrat side and the Republican side, it's always a threadbare. I think now after COVID, it'll be one of those things where there has to be a healthcare reform, or there will be definitely be more consensus towards working for something or safety net for so many people. Because right now, what's really shocking is when the virus first imploded, and the initial measures were assuming that we're going to keep controls over China or people coming in from China, and it'll be fine. But that didn't work. And when the United States sort of had a 6 week head start, the criticism has sort of been um, that it's the United States sort of acted in a manner that's locking the barn door after the horses bolted, because the reports that came in of people who had come from China or had come from other parts of the world, and there was not enough screening done at airports, no temperature checks taken. There was merely, just a form given out saying if you fall ill, these are the CDC helpline numbers. I personally had a friend who came from China and Italy and said they were not checked at all. And then what's happened is now once this virus has come in, it's mutated, it's spread, it's percolated, and it's everywhere right now.
Akshobh, what's the sense of the economic damage that America is incurring? I am told that the rolls of the unemployed have risen steeply.
Yeah, absolutely. I mean, you think about it, the last conundrum we had was a decade ago, 2008 financial crisis, 2007, 2008. In 2007 to 2009, over 2 years, the job losses were between 9 to 10 million over 2 years. In the last 2 weeks alone, as far as March data and April first week data comes out, 10 million people have applied for unemployment benefits. That should just
Right.
put a perspective
Sure.
in.
Right.
It is because what's happened right now is this in the United States, people, a lot of people are daily wage earners. The first people have been hit are people right at the who are people who are surviving on day-to-day minimum hour wages. That's your restaurant workers, entertainment, cinema hall workers, with everything that's deemed non-essential. People are suffering as well. Airlines have been hit. Cab drivers have been hit. Public park workers, metro station workers. Everyone's been hit. If the economic update is initial report said between 2 trillion to $3 trillion economy, the world economy. Now Bloomberg reports 5 trillion. That's like losing Japan. 3 trillion was India's economy, 5 trillion Japan's economy. The United States alone passed a $2 trillion stimulus in Congress. But that might just not be enough. If you hear about news in Japan, Japan's passed the largest ever stimulus bill. And Shinzo Abe called it Japan's worst crisis since World War II. I think more than the financial crisis, people are looking at it like a World War II crisis, except obviously that may be a bit of exaggeration in terms of just, no bombs are dropping, but the loss of lives every day that's been happening, the statistics, the upward curve. The economy is definitely one that's taken a toll for the worse. Everyone's suffering at some form or the other. Even companies like Zoom, because we're using virtual messaging may think that they're doing better, but even they on some level will be hurting on something.
Yeah. Yeah.
Grocery stores and pharmaceuticals and the pharmacies may report an uptick, but even they are constrained because the supply chains are destroyed. And any disruption in supply chains in China means supply chains around the world have been disrupted. Export imports have gone down. The technology industry itself is stretched. It's going to be a scenario. And from an Indian perspective, the H-1Bs are going to get strained as well. This is April, the month of H-1B filing, the month of
Yeah.
tax filing, and all that's just going to get kicked down the road, I guess.
Okay. So last question. How is all this affecting Trump's re-election chances?
So Trump's obviously an incumbent. Now, if you look at the history of U.S. elections in the last 100 years, there have only been four incumbents who have lost. The last one being Bush 41 in '92 to President Clinton, Jimmy Carter, Gerald Ford, and Herbert Hoover. Now, two or three out of the four have been when there's a massive economic meltdown. Bush lost it when there was a recession that came, even though he was a very popular president, Bush 41,
Yeah.
and Herbert
Yeah.
Hoover lost it when the Great Depression hit. Now, Trump obviously has something between a 40% approval rating, which may not be high, but you always normally back the incumbent until something cataclysmic happens. We're right now at cataclysmic in terms of what's happening. Now it's hard to tell what's happening because from 2016 the rule book has been gone out. Many people did not expect a Donald Trump presidency because Trump was a maverick candidate, wasn't a quintessential
Yeah.
Republican
Yeah.
GOP candidate, and he ran against Hillary Clinton, who was the most established candidate to run as two-time senator and secretary of state and former first lady. But it's hard to tell right now because a few things have happened. One is, well, firstly, now Bernie Sanders has dropped out of the Democrat primary, so that means it is inevitable a Joe Biden and a Donald Trump.
Yeah. Yeah.
The path is cleared. Now, Trump and Bernie both rely on large rallies more than Biden because their personalities are very like we're gonna have the grassroots movement. But that's not going to happen right now with social distancing and COVID alerts. So that will, and you saw that's really affected Bernie because Super Tuesday went towards Biden. So I don't know if that's going to affect Trump, and it could likely do it. And it also depends on how people see COVID right now because COVID's a crisis. There's obviously the liberal bent and people who are more critical of the administration, the way they've handled it. But there'll be other people who are like, look, COVID is not a Trump manufactured problem, which is
Yeah.
true.
Yeah.
It's a virus. However, it depends on what they see as effective response or not. It's still early to tell, but let's just say that Trump may not want to be where he is because Trump's strongest mantra has always been the economy was doing well before COVID,
Yeah.
which was there was
Absolutely.
no,
Yeah.
no signs of panicking. Stock market doing well, economy is doing well, with stronger national security because he would have spoken about the Soleimani assassination in Iran as look, I went out and I got the bad guy. That's the way Trump speaks about things. He speaks about it from a very transactional perspective. Look, I've got this trade war with China. I'm going to make sure China not taking our jobs. Now, with all that's happened, everything, the only thing on everyone's mind is COVID. And we can't see when there'll be a sense of normalcy. Even if
Yeah.
hypothetically COVID ends tomorrow, people are not just going to suddenly come back and go to offices. We've all become hypochondriacs and germaphobes,
Yeah.
even the most.
Yeah.
So this is going to stay on for a while. We're debating V-shaped and U-shaped and L-shaped sort of recoveries. The This first quarter has been economically disastrous. The second quarter is going to spill over. We're at least looking till at least June, July, where we hope there'll be some sense of normalcy. But for Trump and Biden, that'll be a very interesting prospect, right? Right now, it's almost hard to tell what's going to happen.
Okay. So uncertainty all around, not just for America, but for the whole world. Akshab Giridhardas, thank you very much for your perspective. Pleasure talking to you.
Surya, the pleasure's all mine. Thank you so much for having me.